Welcome to English Every Day, the podcast. I'm Mary.
And I'm Luke. Hello, everyone.
Today, we have a very important and practical topic, the English you need for a doctor's visit.
That's right. Going to the doctor can be stressful, and it's even more difficult if you are worried about the language.
Our goal today is to help you feel more confident. We'll teach you the exact words and phrases you need to explain your health problems clearly to a doctor or nurse.
Let's get started. The first thing you will probably hear is a question. The doctor or nurse might ask, "What brings you in today?"
Exactly. This is a common way to ask, "Why are you here?" or "What is your problem?" You need a simple way to answer. You can say, "I'm not feeling well."
I'm not feeling well. That's a great simple phrase. Another one is, I've been feeling sick.
Right. Let's repeat those. I'm not feeling well.
Or, I've been feeling sick. You could also just say, I'm sick.
Perfect. Okay, so after you say you're not feeling well, you'll need to give more details. Let's talk about pain.
Yes, describing the type of pain is very helpful for the doctor. There are a few key words for this. For example, is the pain sharp? A sharp pain is a sudden, strong pain.
Right, like a knife. It's quick and intense. The opposite might be a dull pain or a dull ache. This is a pain that is not very strong, but it's there all the time.
A dull ache. Good one. You might also have a throbbing pain. This is a pain that feels like a pulse or a beat. Boom, boom, boom. People often describe headaches this way.
A throbbing headache. Another word is a burning pain or a burning sensation. This feels hot, like fire.
So let's review those words for pain. Sharp, dull, throbbing, and burning.
Now you know how to describe the pain, but you need to say where the pain is.
The easiest way is to say, my hurts. You just add the body part. For example, my head hurts.
Or my stomach hurts. You can also point to the area and say, it hurts here.
Yes, pointing is very helpful. Another useful phrase is, I have a pain in my. For example, I have a pain in my back, or I have a pain in my shoulder.
So you can say, my back hurts, or I have a pain in my back. They both mean the same thing.
Exactly. Let's move on. After you say where it hurts, the doctor will want to know how much it hurts. This is called rating your pain.
They might ask, on a scale of 1 to 10, with 10 being the worst pain imaginable, how would you rate your pain?
That can be a difficult question. If you don't want to use numbers, you can use words like mild, moderate, or severe.
Right. Mild pain is a little bit of pain. It's not so bad. You can say, the pain is mild.
Moderate pain is in the middle. It's more serious than mild pain. The pain is moderate.
And severe pain is very, very bad pain. The pain is severe.
Let's repeat those. Mild, moderate, severe. Using these words is very clear.
Okay, the next question you will probably hear is, when did it start? The doctor wants to know the timeline.
You can use simple time expressions. You can say, it started this morning, or it started yesterday.
Or you could be more general. It started a few days ago, or it started last week.
That's very clear. Let's practice one. If the pain started 2 days ago, you can say, it started 2 days ago.
Perfect. Next, they might ask if the pain is constant.
Right. Is the pain constant? Constant means all the time, without stopping.
So you can answer, yes, it's constant. Or if it stops and starts again, you can say, no, it comes and goes.
It comes and goes. That's a very natural phrase. It means the pain is not always there. It appears and then disappears.
So the two key phrases are, it's constant or it comes and goes.
Okay, now let's talk about some specific symptoms. Let's start with cold and flu symptoms. These are very common.
Yes, you can tell the doctor, I have a cough, or I have a fever. A fever is when your body temperature is high.
You might also have a sore throat. That's when your throat hurts when you swallow.
I have a sore throat. Another one is a runny nose. That's when liquid comes out of your nose. Or you could have a stuffy nose when you can't breathe through your nose.
Right. And sometimes with a fever, you get chills. Chills are when you feel very cold and shake, even if the room is warm. You can say, I have the chills.
So to recap cold and flu, cough, fever, sore throat, runny nose, stuffy nose, and chills.
Now for another common area, stomach problems.
If your stomach feels bad, you might have nausea. Nausea is the feeling that you are going to vomit. You can say, I feel nauseous.
I feel nauseous. And if you actually do vomit, you can tell the doctor, I have been vomiting.
Another common stomach problem is diarrhea. That's when you have to go to the bathroom many times. You can say, I have diarrhea. The opposite is constipation.
And of course, for general pain, you can say, I have a stomach ache.
Let's move up to head and eye symptoms. We already mentioned headache. A very severe headache is often called a migraine.
Right. I have a migraine. You might also feel dizzy. Dizziness is when you feel like the room is spinning and you might fall down. The phrase is, I feel dizzy.
For your eyes, you might say, my eyes are red, or my eyes are itchy. Itchy is that feeling that makes you want to scratch.
You could also have blurry vision. That means things are not clear when you look at them. You can say, my vision is blurry.
Okay, what about breathing problems? This is very important to explain clearly.
Very important. If you have trouble breathing, you can say, I have shortness of breath, or I'm short of breath.
This means you feel like you can't get enough air. Another symptom is wheezing. That's the high-pitched whistling sound when you breathe. You can tell the doctor, I am wheezing.
And if you have pain when you breathe, you can say, I have chest pain when I breathe.
Great, now for skin problems. A common skin problem is a rash. A rash is a red area on your skin. You can say, I have a rash on my arm.
We mentioned the word itchy before. You can use it here too. My skin is itchy, or the rash is itchy.
You can also have dry skin. Just say, my skin is very dry. Or maybe you have a cut or a burn. You can point and say, I have a cut here, or I burned myself.
Good. We're about halfway through our list. We hope you're finding this helpful.
If you are, please take a moment to like, share, and subscribe, and follow the channel.
It really helps us create more content for you. Thanks for listening.
Now, let's get back to our list. A very common feeling when you're sick is feeling tired.
Yes, you can say, I feel tired all the time, or I feel very tired.
If you are extremely tired, you can use a stronger word like exhausted. I feel exhausted.
Another word you might hear from the doctor is fatigue. Fatigue is a medical term for feeling very tired and having no energy. You can say, I'm experiencing a lot of fatigue.
So tired, exhausted, or fatigue, all good words to use.
Next, let's focus a bit more on describing a fever. We mentioned it earlier with cold symptoms.
Right. You can say, I think I have a fever. This is a good phrase if you feel hot, but you haven't checked your temperature with a thermometer.
If you have checked, you can be more specific. I have a fever of 101 degrees, or just, my temperature is 101.
And as we said before, with a fever, you might have chills. You can connect these ideas. I have a fever and the chills.
Very clear. Okay, let's talk about allergies. This is very important information for your doctor to have.
Yes, if a medicine, food, or something else makes you sick, you have an allergy. The phrase is, I'm allergic to, and then you name the thing.
For example, I'm allergic to penicillin. Penicillin is a common antibiotic. Or, I'm allergic to nuts.
If you don't have any allergies, which is great, you can say, I have no known allergies.
No known allergies. The doctor will always ask this, so it's good to be prepared.
Next, let's talk about medications. The doctor will want to know if you have taken any medicine for your problem.
You can say, I've taken, and then the name of the medicine. For example, I've taken Tylenol for the pain, or I've taken some cough syrup.
It's also important to say if it helped. You could say, I've taken Tylenol, but it didn't help.
Or, it helped a little. That's useful information. Also, be ready to tell the doctor about any other regular medications you take for other conditions.
Speaking of other conditions, that brings us to another important topic, discussing your medical history.
Absolutely. Your doctor needs to know about any significant past illnesses or chronic conditions. A chronic condition is an illness that lasts for a long time, sometimes for your whole life.
Good point. Now, let's talk about what makes your symptoms worse.
The doctor might ask, does anything make it worse? You can answer by saying, it gets worse when I, and then add an action.
For example, if you have back pain, you might say, it gets worse when I stand for a long time, or it gets worse when I walk.
If you have a headache, you could say, it gets worse with bright lights, or it gets worse with loud noises.
And now for the opposite, explaining what makes it better.
Right. The doctor will ask, does anything make it better? The structure of the answer is similar. It gets better when I...
So for that back pain, you might say, it gets better when I lie down, or it gets better when I rest.
You can also mention things you use. For a muscle pain, you could say, ice makes it better, or heat makes it better.
This information helps the doctor understand the type of problem you have.
Okay, next point. Is your symptom getting better or worse over time?
The doctor needs to know the direction things are going. The phrases are very simple. It's getting better, it's getting worse, or it's staying the same.
Let's repeat those. It's getting better.
It's getting worse.
It's staying the same. Very useful and easy to remember.
Now, after you explain your symptoms, the doctor will ask more questions. Let's talk about some common follow-up questions you might hear.
Good idea. They might ask, have you had this problem before? Or are you taking any medications, which we talked about?
They will definitely ask, are you allergic to anything? They might also ask about your lifestyle. For example, do you smoke? Or how much alcohol do you drink?
It's important to answer these questions honestly. The doctor needs all the information to help you. It's okay to say, I don't understand. They can ask in a different way.
That is a great tip. Don't be afraid to ask for clarification.
Okay, we have learned so many useful phrases. For our last point, let's put it all together in a complete, real conversation.
Great idea. Let's do a role play. Luke, you can be the doctor and I'll be the patient.
Sounds good. I'm ready. Let's imagine I'm walking into the examination room. Hello, Mary. I'm Dr. Luke. What brings you in today?
Hello, doctor. I'm not feeling well. I've been feeling very tired and I have a bad sore throat.
Okay, I'm sorry to hear that. When did these symptoms start?
The sore throat started about 3 days ago, and the fatigue started yesterday.
And the sore throat, can you describe the pain? Is it sharp or dull?
It's more of a burning pain. It really hurts when I swallow.
I see. And on a scale of 1 to 10, how would you rate the pain?
I'd say it's moderate, maybe a 6 out of 10.
Okay. Do you have any other symptoms? A fever, chills, a cough?
I think I have a mild fever. I feel hot, but I don't have a cough or chills.
Does anything make the throat pain better or worse?
It gets worse when I talk a lot. Drinking warm tea makes it feel a little better.
And overall, are the symptoms getting worse, better, or staying the same?
I think they're getting a little worse, especially the sore throat.
Have you taken any medication for this?
I've taken some ibuprofen, but it didn't really help.
Okay, just a couple more questions. Are you allergic to any medications?
No, I have no known allergies.
And are you taking any other regular medications?
No, I'm not.
Thank you, Mary. That's very clear. Now I'm just going to take a look at your throat.
And scene. That was great. You see how using those specific phrases gave the doctor a lot of important information in a short time.
Exactly. And that's how a conversation at the doctor's office might go.
We know that was a lot of information. The most important thing is to practice these phrases. You don't have to be perfect.
That's the key. The doctor and the medical staff are there to help you. Using these simple phrases can just make the communication much easier and less stressful for you.
We hope this episode helps you feel more prepared for your next doctor's visit.
Thank you for joining us on English Every Day, the podcast.
Goodbye for now, and take care of yourself.
Goodbye, everyone.